Hi, everyone. This is Caroline from Fiat Integrative Health in Franklin, Tennessee, and you're listening to the Fiat Health Podcast. We believe that now more than ever, the healthcare industry has become a place of confusion. And over the years, we have been asked countless questions about what true health and integration for the whole person looks like. Join us every other week as we explore topics ranging from primary care and women's health to counseling and spiritual health. We're so glad you're here. Hey, everybody. Welcome back to the Fiat Health Podcast. This is Caroline. I'm a family nurse practitioner here at Fiat Integrative Health. And today I'm joined by Dr. Michael Ferry. Hey, Mike.
Hey, Caroline.
For those of you who haven't listened before, Mike was last on the podcast. I think it's been a year now, almost.
It's becoming an annual event.
Yes, our annual review. So Mike and I founded Fiat. Now, when this podcast comes out, it'll be right around our 4-year anniversary, which is kind of crazy to think about that it's been 4 years. So we just wanted to hop on here and kind of go through how exciting and adventurous and crazy the last 4 years have been. Talk a little bit about how we got started for anybody who doesn't know, and what our vision is for the future, which is all just super exciting.
Yeah, it's very exciting.
Yeah. Okay, so how we got started. How did we get started, Mike?
Well, you want the short story or the long story? Or my story or your story?
Let's do your long version.
I'll do my
intermediate version.
It gets longer the more I think about it.
Yeah.
It is really amazing. I love that we are named Fiat because as Christians, we want to be like in a vulnerable position for the work of the Holy Spirit.
Mm-hmm.
And I have always had a propensity to latch on to new ideas, to venture out on new adventures without knowing what's around the corner or whether I could do it or not.
Sure.
So I feel like that put me in a good position of openness when you came.
Barreling through the front door.
Well, you were looking for what was going to be your next job. And you can tell your side of how you ended up suddenly jobless with a whole bunch of loyal patients and great work ethic and work relationships. You came by to brainstorm because we already knew each other and we knew our common heritage, both of faith and like how we approach medicine is very much shared. So the way I recall it, we were brainstorming about what you could do, what options you had. And I think you were sort of going through, do you know contacts out there? Do you know of opportunities? And also you had this thought of like, what if I just started out on my own? And we started talking about what a family practice could look like if it was founded on the principles of revealed truth, and what are kind of all the things in healthcare right now that are aggravating to both providers and patients and restricting us and our ability to be creative and be free and serve patients with dignity. And through that conversation, I can picture it vividly. Did you have Ambrose?
It had to have been Ambrose, yeah. Yeah, he was like 6 months old.
Big Ambrose in a little carrier. And we were sitting at the conference table over at my office a couple blocks from here. And the idea came to life. And I think we both went away from that very excited about the possibility and agreed to do some discernment and prayer together. And over the next few days, it just, I think, really came alive in both of our hearts. And we kept talking and becoming more excited about it. And before long, you had a website, a logo, and your first patient lineup and your first employee.
Yes. Volunteer. I don't know if they count as an employee if they're voluntold. Yes, it's been wild. I feel like, anyone who really lives with the Holy Spirit with that kind of abandonment probably has very similar stories of, and I feel like that's kind of a lot of the theme is like, this can't be real. Or like, is this possible? Like, could this really happen? And just really stepping out to be like, let's at least see what we could do. Like, let's give it a try. And always the Lord just exceeding our expectations beyond what we could have imagined. And for me, I was all of a sudden let go from my job at a private pediatric practice So, I went in on a normal day and I worked a normal day. And by the end of the day, I didn't have a job. So it was very abrupt. And I had immediately, just started networking. And there was a lot of peace in that process. And that's its own podcast story. But I just started networking right away, kind of like, okay, Lord, like, where do you want me? Like, where's the open door? And I had a couple different interviews with different practices and some different opportunities. And I just had this like really strong, like nagging on my heart of like, it's going to be really hard to go back to a job for a job's sake. Like it would just be hard to work a job because it paid well. But if my like heart wasn't really in it or it wasn't the work that I wanted to be doing, I would ultimately have a hard time and be dissatisfied. And so I had this tiny idea of a family practice that in my head when we met, I feel like I just kind of word vomited a lot of like, I don't know, like if this could ever happen. I had met with a couple nurse practitioners who had open practices and, it took them 6 months and they took out this massive loan and they weren't even paying themselves yet. And like, I was like, that just isn't a reality for our family. And so I just don't think it's possible for me to open something. But I, like you said, at the same time, see this opportunity. I have these patients who are texting me, like, please open your own practice. And my response in my head is like, that's so funny. That's never going to happen. So yeah, when I walked in your door, it was really just a like, I don't know why I'm here. And I don't know, what's going to come of this. I definitely had no expectations.
It's a good way to be.
Yeah. And through our conversation and, you were, I love working with you in so many different ways. And one of the reasons is like your openness to new and exciting things. And I think we're very similar in that way of like, yeah, that sounds crazy, but why not? And you really were like, well, here's all the things I can basically bring to the table. And it just happened to be that, all of the things that I needed, a space, to open and support and, a shared vision with somebody. And, it's just really awesome and really took the next couple of weeks in the beginning phases to, I can't say weeks, honestly, it was like days, like you said, of like, okay, Lord, is this really where you're calling us to? Like, this seems crazy. Like, this is wild to be like, let's just open a medical practice. But it was so clear that like the doors were open. It was like, both me and my husband were like, how could we not at least try? And so, yeah, we opened with like over 200 appointments or like patients scheduled on the books. We opened 5 weeks after the day I got fired. Like all of that is just like pretty crazy to me. Yeah, when you look back, I feel like when we were in it, you're just like running and gunning. It was like, okay, well, my husband just happens to be a general contractor and he can like do all the work that needs to be done on the office like today, like drop everything. We had Costco pizza on the conference table like a couple weekends in a row. I feel like, just like trying to get things done. And yeah, just so, there are so many like tiny little stories of like God winks of like things falling into place that were just so evident of his hand and his providence in all of this. And then, that was like, yeah, we started with just me, which is still kind of hard to believe because very quickly people, before we even opened, I had a phone call from Jen who works for us. And she's like, hey, I heard you're starting a practice. I didn't even have a website up. And so it was, and she's like, so how long have you been, thinking about doing this? And I was like, oh, 3 weeks. And she was like, excuse me?
But she's also someone like so many who are kind of sent here open, ready to take on a risk, not too worried, confident in
totally.
Work God is doing.
Yeah. And just like, yeah, I wanna be along for the ride, which it was at the beginning. It was very much like, we this is all we can offer. But like, if you want to join, Meg, one of our prayer partners, would answer the phone. She worked for us as a receptionist at first, and now she does just praying with people and intercessory prayer. She would say to patients like, yeah, just like, you want to join the ark? Like, come on, we're building an ark. Just hop on, which I thought was just so funny, but so accurate too. Like, come on, they're coming 2 by 2. Yeah, so that was really the beginning, was just really a blank slate. Like, we knew that there was a clear need in the area for really good primary care that addressed the person as a whole. We had always, from the very beginning, obviously you're a psychiatrist, had wanted to bring on the mental health aspect and recognize that as something that was really needed, as well as the primary care. But then from there, we were like, whatever you want, Lord, we'll see who you bring through the door. And, we got in contact with a counselor basically within the first month. I don't even think we had opened yet. Similarly, it was like, I heard you're opening something. Family, 2 FNPs who started with us. Maddie called us again. Like, it was just people started coming from nowhere, it felt like, and just really wanting to join. And it's been just really awesome to see that that's persisted. I think the only jobs we've really hunted for were a receptionist and our medical director were the ones that we were like, okay, we'd really like to seek this out. Otherwise, people just came to us.
Yeah. It took us a little while actually to get used to hiring because we were used to people, providers showing up at the door saying, I feel like I'm called to be here.
I want to join what you're doing. And we were like, what is this advertisement hiring process?
There's really kind of a special period that, is not really replicatable. But the beginning of starting a business is always very exciting. But beginning of this, we've been involved in other endeavors before. And this is just very special because of how fast things could come together based around a vision and how many people were sent literally, who just randomly found out about it and it resonated so deeply with them at that moment, especially coming out of COVID era and all that. There's just a deep resonance that will probably, it's formed the character of who we are as an organization.
Yeah, absolutely. And so going from, basically where we started of like sharing an office with you and your practice, we had 2 exam rooms or 3. Yeah, it was tight. And I predicted, I was like, I think we're going to outgrow this in like 9 months. And that was right about that time. And we landed in this office that we're currently sitting in. And that was a 3-year lease, which I don't know if we thought it was short at first, but like in commercial rental standards, that's like a pretty short lease. But we wanted that because we knew that there was a high possibility that we would outgrow this space in 3 years, which again, just seems kind of crazy to think about. But I remember when we went to sign the lease for this current office that we're in right now, we didn't have the money like to cover the lease for the next month. We were like really, truly living on a prayer. We were like, we know this is where we're supposed to be. We're confident in that. But we don't quite have the monthly income to cover our rent. So we're just going to like hope and pray it works. And that next month, it was just like, bam. I don't know. I could probably dig and figure out why, but for whatever reason, our income went up just enough that then we were like covering the rent from then on out. That's basically what we're doing again for this next move.
Because we're coming up on the last month of our lease here.
Yep.
In a month and a half.
Yep. And we're like, we kind of have enough. We're in a little bit of a better spot, but it's still pretty like risky to do this. And one of the funny things about looking for this new office is that we've been in the process of looking for a new office for a year now. And I think it again goes back to just like the Lord showing us like, you think you know what you need, but actually you don't. Because we started looking like, okay, we want just barely a little bit bigger than this space, right? It was like maybe 1,000 more square feet with like 2 more offices, but like that's it. We don't want to like grow any bigger than that. That's all we need. So we looked through 3 different offices like that. Is that right?
Not to mention
many
60
more.
to 100 more calls. And
we went through at least 2 other leases, not 3, where we
began the process.
Yeah, started the process, started like the build out. And for whatever reason, they weren't working out. Like one of them was like, we don't want a primary care office with sick kids walking through our building. After like 3 months of...
Could have told us that at the beginning.
Yeah, exactly. I was like, could you have figured that out a little bit sooner? That'd be nice. Yeah, very long process. And then finally, we basically were like, we have to be out of our office. Like, our lease is ending. Like, we thought we were like being really proactive starting a year ago. Like, we're going to have an office in hand. And now we're getting to the point where we were like, we're about to end up on the street seeing people. And so, like, basically the only office in all of Cool Springs that fit our needs, didn't need a complete full build out, is the office we're moving into. And it is double the size of what we were originally looking at. And it turns out that we actually kind of need all that space.
In the last year that we've been looking, a couple of things have happened. We've had some amazing team members join, and we're also kind of really getting more clear on what we do well and where the need is. And so we can see the growth potential there. So doubling our spaces, and we have a 5-year lease coming up.
Yep, 5-year lease
we'll
of
need
this
more
office.
Space at the end of that.
Yeah, I mean, we'll see. Obviously, again, when we interviewed Dr. Ed, when I did the initial interview, he said, "What's your 5-year plan for Fiat?" And I was like, "Whatever the Lord wants." I know that's not a business plan, but that's pretty much our business plan. Like, we have a vague idea, but every time I think I know what it's going to be, we think this is how much space we need. It doesn't end up being that. So I kind of, we're like, whatever you want, Lord. But yeah, definitely the space has been really cool to see that come together. We were able to hire 2 new primary care providers, 2 new women's health providers. We would like to soon hire another counselor. It's kind of in the wings. And we have space for all of that, which if we had done what we thought we needed a year ago, we wouldn't really have space for that. And it's really cool to see. So yeah, let's talk a little bit about just what's happened in the last year, some recent updates, and then what we are thinking about for the future, what we're looking forward to. So what's happened in the last year?
For me, the biggest, most exciting thing in the last year is meeting and hiring Dr. Glenn, Dr. Ed. And that's another so obvious sign of God's providence. Both for him, when you hear him talk about how he found his way here, and for us, who had kind of given up of our own accord,
100%.
trying to be able to find somebody who fit the bill.
Yeah.
But he walked in and checked every box.
Yeah.
And then some. We weren't necessarily looking for someone who is an expert in processes and setting up systems, and deeply curious about AI and how that can help. And he's experienced the disenfranchisement, I guess, of like what he calls healthcare 2.0, and of the care that goes quickly, it's expensive, and it's modeled after acute trauma care, I guess. So it's expensive, it's fast. The person doesn't have to say anything, is not listened to, and that's not very good at managing chronic disease or helping people flourish and be healthy, or hearing people and their concerns. So he's beyond that, and come to us with looking for a place to be able to land and practice personalized, holistic healthcare again.
Yeah. It's been super, super exciting to see. Yeah, just that position that I know I've said it. If you've been on the podcast, I've said it. I feel like at least feels like a lot of times, but probably not, that we searched for very intentionally, prayed for very intentionally for 3 years. Like, from the moment we started talking, it was like, it would be great to have a medical director. It'd be really great to find a physician who fits this. And I mean, that has just been its own journey. And, we flew to Denver for a medical association conference to be like, maybe we'll find a physician here,
Set up our table.
Set up a little table, come join us. And then, we went through various physicians. I think we went through 3 or 4 that we interviewed, talked to, never really worked out, and gave up. I took the posting off of our website probably a week before Dr. Ed called. And I kind of just all right, Lord, you just wanted us to be a nurse practitioner run practice, I guess. That's fine. I'm just going to stop looking and stop wondering who this person is. And I never ever would have guessed that Dr. Ed would have been the person, that would have walked through our door. So that's just been super fun to see. And he's just integrated with the culture of the office so well, and just, it's been beautiful. And I think too, something else that he's really brought to the table, like you said, like the policies and standardizing things in a good way, right? Bringing our care to like the next level of, it's not just now me and one other nurse practitioner, like going about and able to sit at lunch and talk through patients. Like we're busy and we have 6 providers now. And so now we've started doing, we have a weekly meeting all together that's very organized and on documents and has AI notes that are taken because it's recorded. And then, and it's just like accelerating our learning and our ability to serve our patients in a way that, me alone could never have done. And I think that's one thing too that I just really love, because I know a lot of, whether it's mid-levels or physicians who kind of open up their own clinic and it's just them, running by themselves. And to see the value of a team approach is really fun as a provider. We had one provider come over and sit in on one of our meetings. He runs his own practice, solo by himself. And he was like, I think I realized that I'm actually just really lonely. That it's really lonely to just sit here by yourself and see your patients. And it's a lot of fun to be able to talk through different patient cases, to talk through how are you managing your lipid profiles. And one thing, we actually had our like weekly meeting this morning, and we were all just kind of lamenting in some ways of like, it's so much easier to do medicine the way that Western medicine is done, like A plus B equals C. And that's, you don't have to really think about it. And that when you're really trying to do like this more like, I guess you would say like cutting edge or integrative approach where you're staying up to date with the latest literature and recommendations and new studies that the guidelines are way far behind, it takes a lot more work. It takes a lot of time to do that. So it's exciting though. I wouldn't do it any other way.
Yeah. I mean, that's one of the things we value and want to bring to the table is we don't just want to be based on guidelines and algorithms, because we've seen how those can go awry or be politicized or be very biased in ways that are subtle but kind of foundational.
Mm-hmm.
So right from the beginning, we committed to being very open and seeking the truth, looking, being on the front line of looking at what's the newest stuff coming down pipeline or new experiences providers are having, and being open to trying those things, listening to patients about what has worked for them and applied to others.
Yeah. I always love that too. When patients are like, have you heard about this? I'm like, no, but I'm going to go look at it now because you brought it up and you heard about it and it's working for you. So like, let's investigate that. I think another exciting thing that we're kind of expanded on in the last year, and I think we'll really dive more into as well, is just our women's health, restorative reproductive medicine side. It's been really great to see, I don't know if great's actually the right word, that there's a real need for it, that, infertility is rising and IVF is not the answer for many reasons. And how can we restore the body to the way that it's supposed to function in order to achieve a pregnancy and maintain a pregnancy? And that's just been really awesome to see, people, their lives being changed truly by coming and seeing our women's health team is really beautiful.
Yes, quite literally. More lives happening because of it.
Yes, exactly.
Yeah, that was not something we anticipated 4 years ago, that we would be caught up in this need for an authentic and holistic and integrated women's healthcare, especially around infertility and related areas. But it's really clear that that's who we're called to help. One of the big things that we do and we see a need for.
Yeah.
Yeah. So I think too that the science, which I think has been really closed down to real deep fertility research, because the answer pharmaceutically, if it's not pharmaceutical, like hormone-based symptom management or in vitro, which costs a lot, and so it brings in a lot of money, the research has not been there. But I think we are starting to see it's not just coming out of like Catholic centers where there's a lot of good fertility research, but other whether it's in academia or other areas, there's better and better research, especially with the longevity research that's happening, and all kind of under the umbrella a new approach needed for healthcare that listens to the patient, that really wants to seek wellness and fullness and not just like fix bones or inject insulin. So yeah, I think we're much clearer on what we do well. We do women's health, we do family medicine. We especially like taking care of young families, big families, new babies, and moms who need all the help caring for their little ones and for moms to be.
Yeah, and I think too, we're really like reaching into like that specialized adult care, especially Dr. Ed. You know, he does really well with adults in general and men especially, which we're very grateful for. And then, you know, you think of like perimenopausal and menopausal women as well, you know, we have Sarah who has like a special certification in that, and we do bioidentical hormone replacement. And that can sometimes feel like the Wild West a little bit because everywhere you go, it's different and, you know, it's not as well studied and standardized. And so doing it safely, and she does such a phenomenal job with that. And just, you know, she's like, why suffer needlessly, you know, when we can really help these women who are maybe having a really hard time. But yeah, I'm excited for the next year. I don't know what's in store. I know that we're going to be in a new office, and I know that we're almost full in this new office space that has like 20 offices, which is amazing. And we're going from, you know, one of the things is that we were waitlisting people. And so that was just really hard because people would even come up to me like after church and be like, I'm on your wait list, or I have a friend who's on your wait list. Like, basically, what can I do in a very nice way? They're saying like to not be on the wait list anymore. And so it's always hard to say no to people. And so now being able to like say yes, and who knows how long that'll last. I mean, we will eventually have to say no again and be full. But for now, you know, we've really expanded because we saw the need, and we really want to serve the community with what we're good at, like you're saying. So I appreciate. All right. Any closing thoughts?
I feel like we should just also touch on the providers themselves, that we really from the beginning envisioned Fiat as sort of a garden where providers and healthcare providers could work together and kind of put down roots and flourish in their own various ways, not sort of all spread apart, but together in a garden. And looking at it 4 years now and seeing who's all here and how they've put down their roots, and how around the table in the lunchroom, for instance, there's a real sense of community and belonging, but also inquiry and curiosity, and understand how everyone else feels alone.
Yeah. And just learning from one another. Yeah, it is. It's like, you know, we took that, what I feel like for providers, you feel like a cog in a wheel, you know, when you're in just like standard medicine. It's like you could be replaced by anyone. You're not unique. Like you're just filling this role in this box, and like that's it. And being able to, that picture of a garden and everything, everyone who flourishes looks different. And you have your own art of medicine about you, but we're all, you know, really facing towards the truth. That's what we're seeking after together. It's not also like everyone do your own thing no matter what.
We are oriented towards truth and encouraging each other on the way there.
Yeah, it's just really a privilege, and I'm just so grateful for it. And yeah, it's exciting. Awesome. Well, thanks, Mike.
Till next year.
Hopefully sooner. Maybe. We'll see. Thanks for listening to this week's episode. To learn more, you can visit our website at fiathealth.org. If you enjoyed this episode and you'd like to help support the podcast, please subscribe to our show on your favorite podcast platform and leave us a review. This helps make the podcast easier to find. Lastly, if you'd like to reach out, ask a question, or suggest a topic for a future show, send us an email at media@fiathealth.org. God bless.